Hi everyone, I want to talk about febrile seizures treatment. When it comes to febrile seizures, most of the times it will resolve spontaneously. In fact, it would have resolved before the family or the emergency crew will reach the emergency room. At emergency room or the emergency crew on their way to emergency room and the child is still having the convulsion, you can give lorazepam 0.1 milligram per kilogram intravenously or diazepam 0.1 milligram per kilogram intravenously and mechanical ventilation. And if required, you can give midazolam intramuscularly. There's possibility of using intranasal lorazepam or buccal midazolam. Diazepam suppository is also applicable. If benzodiazepines should fail, or febrile seizures epilepticus, then you can use Phenytoin or Fosphenytoin. Phenobarbital could be used, and in some quarters in other parts of the world, Paraldehyde is still used. And of course, valproic acid is also welcome. Other measures could be just simply using cooling blanket to suppress the fever, and of course, antipyretics could be applied here. Still on treatment, if it is simple, discharge after a few hours and educate the parents. If it is complex, please observe for a longer period. If you have the space, you can observe for as long as 24 hours. The possible prognosis, 65% will never have seizure again, and 30% will have recurrent febrile seizures, while 3% will have seizures without fever, and 2% will have full-blown epilepsy. Recurrence increases with young age at onset. That is, if the first time the child will come down with febrile seizure is towards the first year of life, then the likelihood of recurrence is higher. The likelihood of recurrence will be higher in children with positive family history of febrile seizures, particularly in first-degree relatives. And if there's short time between the onset of fever and the onset of the first seizures, then the likelihood of recurrence is high. Lower level of fever at the emergency room is an indication that it's likely going to recur again. To discharge, you can let the parents go on with rectal gel diazepam 0.5 milligram per kg. Also, midazolam nasal spray with the help of the pharmacist to explain fully to them how that could be applied. And of course, as physicians, we'll do that on our own as well. But I know the pharmacist will reiterate that too while dispensing. Antipyretics once the temperature is rising. And of course, Phenobarbital prevents its production. And I need to say categorically here that anti-epileptic drugs are not required. They are not needed here. On follow-up, you can have outpatient electroencephalogram. That is good to rule out a possible underlying seizure disorder or disorders. Magnetic resonance imaging may reveal hippocampal injury, particularly in febrile seizure that is complex. And febrile seizure may lead to temporal lobe epilepsy, but that is not yet proven. And with that, I come to the end of this very presentation, and my next presentation will be on how to educate the parents as far febrile seizures and other seizures and what to do when their children are down with such situation. Thanks for listening to my presentation. Kindly subscribe so that you can get these presentations immediately they are published. Thank you.